This is Tugas. How you doing today?
Good.
Man, you come in here a lot.
I know.
You know your insurance company is rejecting our claims now because you've been in here so often. So we're gonna have to send the bills all to your husband. Okay. Do you think that'll be all right? I think he'll take care of it. That's all I'm
Maybe.
saying.
I hope so.
Okay. All right. Today we're gonna be doing a musculoskeletal assessment. Okay. I'm gonna go ahead and wash my hands. All right.
Okay.
Okay. So first of all, I just want to know, any cramping, any pain, or anything like that, any of your legs, any issues along those lines? No.
No.
Okay. Very good. No stiffness. Okay. We're going to be looking at her throughout the scope of the exam, and anytime that I'm going to be palpating, which means touching certain areas like your joints. If there's any pain or anything along those lines, I just want you to let me know about it. Okay. We're going to be feeling for crepitus, cracks, pops. If any of that stuff comes up, then we'll be dealing with it appropriately. Um, uh, if there's any painful issues that would come up, we would be wanting to relate that information to what its impact is on activities of daily living, um, uh, things along those lines, so we can kind of assess how it's affecting our patient in all reality from their life. Um, any history of injuries for you, like skeletal issues, sprains, breaks, anything along those lines? Broken feet, broken noses, broken anything
Broke my arm once.
when you were a kid?
Yeah.
Everything healed up well?
Mm-hmm.
Okay, good. No problems?
Nope.
No surgery?
No.
Okay, great. Um, Another important question we want to ask our patient, especially uh, when we get into a lot of the men, is what kind of employment do you do?
I'm a teacher.
You're a teacher. Hence, wow, you must feel right at home in this pediatric office of mine. Okay.
Mm-hmm.
Um, our patients were plumbers, skilled tradesmen, factory workers, things along those lines. People who lay tile, they'll end up with significant arthritic problems, perhaps before we would be triggered to really look for it. So we need to be cognizant of those kinds of things as far as what their employment is, um, so we know where to focus our exam. I'm going to go ahead and have you stand up. When we've got her standing up, we're going to want to just take a look at her, and I'm going to have you go ahead and just go for a walk for a minute there. I'm looking at her gait and her posture while she's walking. Um, while we've got her standing up, I'm going to go ahead and have you, if you could turn around for me, and I'm going to have you touch your toes. Good. And what I'm looking here for is, excuse me here, just looking at your back, okay? Good. So we're looking for alignment of the vertebrae, making sure that there's, you can go ahead and stand up now, thank you. Making sure that there's no issues, lordosis, kyphosis, scoliosis, things along those lines. Her posture's good, no lordosis, no scoliosis or kyphosis while she's bending down. We're going to take a look at her muscle characteristics, looking for edema, spasms, any kind of masses around the joints or in the muscle areas, joint atrophy, hypertrophy, tone problems and irregularities. We'll be feeling, palpating for heat, tenderness, swelling, and then the crepitus, which is like the popping and cracking in the joint. Assessing her ability to resist pressure. We'll be doing range of motion, active and passive, and assessing joint function that way. So next thing I'm going to have you do is I'm going to have you can go ahead and have a seat real quick there. I'm going to start from the head. We're going to check your temporal mandibular joint for TMJ. So what I'm going to have you do, I'm going to palpate in the joint spaces while you open and shut your mouth. Good, okay, all right, good. No cracking, no popping or anything like that. That's fantastic. Go ahead and clench down. Good, okay, move your jaw forward, backwards, side to side. Okay, good. You don't develop any painful headaches or anything along those lines? There was no pain or anything while I was doing that? Good. So you don't. Patients with TMJ problems will often have um, difficulty with chronic headaches. So we want to be cognizant of that. Can I have you open your mouth real wide? Good. Okay. There should be a good 3 to 6 centimeters between the upper and lower teeth. So that's good. While she's sliding the jaw from right to left, the mandible should move freely in either direction, which it did. And I'm going to have you, and she did her chin forward and chin back. She's able to move that, and that's good. So that's what we're looking for. Now what I want you to do is I'm going to, so try to open your mouth. Good. Okay, great. Now open your mouth. Try to close it. Good. Okay. Good joint pressure there, so no problems along those lines. Now we're going to check the cervical spine. So if I can get you to stand up. Actually, go ahead and, yep, okay, good. Just turn around. So posterior neck, cervical spine, the paravertebral area. So we're going to look down the spine. We're going to look at the trapezius and the sternocleidomastoid to make sure everything's good there. Everything's symmetrical. No pain at all, right? When I'm feeling that. Okay. All right. I'm going to have you go ahead and turn around, and we're going to do range of motion. So can you put your chin to your chest? There should be a 45-degree angle there, and there is, and that's good. And up to the ceiling, again, 45 degrees, that's good. To the shoulder, side to side, looking for 40-degree angle there, excellent. And your chin to your shoulder, so like this, good, excellent. That should be 70 degrees, so that's great. Alignment, so we're looking at the back of her neck to making, which we did a minute ago, making sure that there's proper alignment there, and there's no problems there. Go ahead and just bend down for me. Okay, good. C7 through T1, all is well there. Again, there's no curvature of the back, no lordosis, scoliosis, kyphosis that I can put my finger on. So that's good. So we're all set there. We're going to go ahead and check her ability to stand, just general stuff, which we did when we had her moving around. So that's great. All is well along those lines. We're going to check all of her spinal processes. And there's no pain when I'm doing any of this?
No.
Good. We already had her touch her toes. So what I'm going to go ahead and, good. So what I'm going to have you do is I want you to bend this way and that way. Okay. Should have about a 30-degree angle there, and that's good. Go ahead and touch toes again. Very good. That's great. It should be 75 or 90-degree of range of motion, to which there is. So no problems there. Go ahead and turn like that. Good. Again, we should have another like 30 degrees of rotation either way. And we do. So we're good to go there. Can you do this for me? Hyperextension? Good. All right. Very good. So we're going to check her shoulders. All right. And we've got good symmetry, so that's good. No problems. Scapula area. No pain there?
Nope.
Good. So we're going to palpate. That's the inspection. We're palpating now. Shoulder joint. Sternoclavicular joint. Acromyoclavicular joint. And no pain in there, right?
Mm-mm.
Good. 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 No popping or anything like that I'm feeling. That's good. Excellent. Good. Can you shrug your shoulders for me? Good. I'm going to put some pressure on now. So shrug them again. Excellent. Now try to bring them down. Okay. Go ahead and try to put your arm down there. Good. Push it up. Good. Up and down. Good. Other way. Excellent. So we're going to check the right here at the elbow. Okay. I want you to go ahead and flex your arms. Good. And then hyperextend them. Good. The other one too. Here we go. I'll tell you what, I'm going to have you go ahead and turn around. Good. Okay. So hyperextension is supposed to be about 50 degrees, and flexing is supposed to be 180 degrees. So that's rocking and rolling. Go ahead and okay. Out. Good. Other. Good. Now. Good. Run back. Excellent. Up. Good. Okay. Great. So she's able to abduct her arms, adduct her arms. That's great. Internal rotation. So can you do? Good. External. Good. Both of those are supposed to be 90 degrees, and we already did. We already checked your ability to oppose force with your arms. So that's good. So we're going to check out your elbows. We already did flexing and extension of the elbow. That's good. The carrying angle of the elbow should be about 15 degrees. Okay. And the forearm is supposed to deviate medially a little bit. Okay, great. We're going to palpate, looking the extensor surface, the elbow, or the ulna, the olecranon process, the epicondyles, and there's no tenderness, no pain. Okay. Good. And she has good, we already established, she has good range of motion of the elbows in all directions, so that's great. All right, so we're going to check out the hands and the wrists. You can go ahead and have a seat. Good. So we're going to look at the dorsal and the palmar surfaces of the hand while we're inspecting them. We're looking for symmetry, shape. We're going to count her fingers, make sure she has all of them. You have 5 fingers?
I do.
Good. Okay. 10 total, right? Okay. We're going to look at the creases in her hands that can point out things like anemia, like we had talked about during the cardio assessment. Thenar eminence and hypothenar eminence. So, good. Any pain there at all? And that's the thenar muscle right there. And the hypothenar. No pain on the outside there. All right, good deal. All right, so we're going to check her joints, the interphalangeal joints, both distal and peripheral. No pain or anything in any of these joints. No. And now, if we're dealing with somebody who's types a lot, a secretary, professional tennis player, or somebody who has hobbies like crocheting, that kind of thing, we want to look for carpal tunnel syndrome. No pain in there. We're going to do Tinel. This is Tinel sign. Good. Great. So all is well with the arms. That's good so far. Flexion of the fingers is good. That's supposed to be about 90 degrees. hyperextension of the fingers is lesser. It's about 20 or so degrees, and that's good. Just able to do that. Can you touch your thumb to each fingertip? Good. Now what I want you to do is do this right here. Good. I'm going to try to separate them. Good. There's good strength there. Again, good strength there. And let's do that with your other fingers. Oops. Good. Pinky. Excellent. Okay. So that's good. Let's see. We're going to. We said we hyperextended the wrist. So that's good. Hand grasp. Go ahead and squeeze my hand. Squeeze my other hand. Okay. Make a fist. And try to break my try to break the fist there. Good. Can you just without doing the whole elbow, just try to. There you go. Okay. Good. Excellent. So now we're going to check the hips. So anteriorly, posteriorly, we're going to look at the greater trochanter, the iliac crest, the gluteal folds. So go ahead and stand up. And this is inspection. So if you turn around for me, just making sure everything looks lateral. We don't have one hip lower than the other or anything along those lines. Keep turning. Okay, great. Now we're going to go ahead and palpate the hips. The pelvis. So. No pain in there?
It tickles.
It tickles. Good. Palpating the pelvis. Excellent. Okay. So I'm gonna go ahead and have you sit down. Actually, what I'm gonna have you do is if you can kick your legs out to the side like that. Good. Your other one? Good. And now the other way, like that. Good. Okay. All right, good. Can you rotate them? You can hold on to something if you need to. Okay, good. There's good rotation. Abduction is supposed to be 45 degrees. Adduction, 30 degrees. Internal rotation should be 40 degrees. External is 45. And hip flexion is 90. Hyperextension is like 30 degrees. So I'm going to go ahead and have you lay down, and we're going to bring your knees to your chest. Okay. Can you bring your knees to the chest? Good. Right. Hip flexion, 120 degrees. So that's good. All right, very good. No pain at all when you're doing any of that? All right, cool. So we're going to check out the knees now. The knees are pretty complicated because there's a whole bunch of ligaments in there, a bunch of epicondyles, and excuse me, all that good stuff. So I'm going to look at the inspection. I'm going to look at the knees flexed and extended. So can you go ahead and yeah, you want to. What's that?
They're pretty.
I'm a doctor. They don't have to be pretty today. Or nurse practitioner. Okay. So all right. So that's good. Can you go ahead and go ahead and kick them out. All right, and then kind of bunch them up. Good. So that's inspection. Making sure that everything's symmetrical. There's no pain at all when you're doing any of that. All right, good deal. Go ahead and stand up. We're going to look for knock knees, which are when the knees are come together like this. And we assessed that on her walking, that wasn't, that she didn't have any problems with that. And then bow-legged knees, which is when patients do this, and there's no issues with that either. Also, sometimes patients can have problems with hyperextension, where the leg is curved kind of opposite the actual anatomy of the knee, and we don't have any issues with that as well. We would see that while she is walking around, so that's good. We're going to go ahead and palpate the knee now. You can go ahead and have a seat right here for me. Good. So while we're looking at it, We're going to feel in the popliteal space, in the tibiofemoral joint, patella, suprapatellar pouch, which is right behind the kneecap. Any pain at all when I'm doing any of that? Good. Fat pad, intrapatellar fat pad. Good. All right. All of our epicondyles are there and everything's symmetrical. I'm going to go ahead and have you lay down for me. Well, you can go the other way. And this time you can go all the way back and lay down on your back. Very good. So I'm going to do a couple tests. We're going to look. We're going to do bulge sign for looking for knee effusion. We're going to be doing McMurray sign looking for meniscal tear, and we're going to do ballottement where we're looking for fluid on rebound on the kneecap. So with ballottement, we're going to go ahead and take our hand and kind of push down, and then if there were any fluid in the knee, it would be pushing distally toward the foot. So, and then we just take our finger and press down as though we were looking for edema. And if there's a lot of rebound, then that could indicate that there's fluid built up in there that we would need to deal with. Okay, and there are no problems with that. We're going to do bulge sign, looking for the effusion in the knee, if there is any. We're going to go up the medial aspect of the knee and then down the lateral side, and then look for a bulge as we're pushing fluid in the medial side. So, so up the lateral side, I'm sorry, up the medial side, down the lateral, and then there would be fluid in the medial side, and there's not. Great, no problems there. So that's good. I'm going to go ahead and do McMurray's sign. So, what I'm doing is I'm going to rotate while I'm palpating the joint. Laterally and medially. No pain at all? Okay, I'm feeling for crepitus, and there is none, so that's good. Good. Okay. You can go ahead and actually, I'm going to have you bring your knees up. Good, no pain there. And then go ahead and extend them all the way. Great. Okay. You can have a seat. Okay. Let me have you bring them all the way up in line. Good. Is that good? So that's about as far as they go. They don't really hyperextend very much. That's good. So again, for the ankles, we assessed a lot on while she was walking. So we're going to check alignment, contour, symmetry, the bone structure itself, just like we did for everything else. So no pain at all here?
Mm-hmm.
Go ahead and push. Go ahead and rotate them in. Rotate them out. Good. Other one. In and out. All around. Okay. Good. No pain there. No crepitus while I'm feeling. No pain. No discomfort. Good. Good. You have 10 toes. Congratulations. 10 fingers and 10 toes. That's fantastic. Good. My last patient had 15, so it was kind of weird.
That's interesting.
Yeah. Looking for in-toeing, out-toeing. We're going to be looking for flat foot, and I'm going to do a test with, we could use water, dip her foot in water, and then have her step on construction paper. And with flat foot, you would not see, there would be no missing area, which is the arch. So we don't have, well, that's what we would do. So we're going to be looking for a hammer toe. There's no hammer toe. Claw toe. There's no claw toe problems. Hallus valgus, which is deviation, a lateral deviation of the greater toe, and a lot of times I see this in older like geriatric patients. I don't see any of that, so that's good. Check the interphalangeal joints. No problems there? Go ahead and push. Good. Up and good deal. No pain?
No.
All right. No checking the Achilles tendon. No problems there. Good. All right. When it comes to some of the foot deformities, like hammer toe, a lot of times that's caused by bunions, and we don't have any issues with bunions right now. So go ahead and flex the foot. So, and then up and down. Good. Okay. Good. And out that way. That way. All right. So that all looks good. Dorsiflexion should be 20 degrees. Flexion is 40. Inversion is 30. Eversion is 20 degrees. Abduction is 10. Adduction of the foot is 20. And she should be able to flex and extend her toes. Awesome. What a good patient. Okay. The last thing that we would do is good old measuring tape. So we could measure in centimeters her extremities. Make sure about the same. Go up. Good. About 67. Go ahead and stand up for me. Good. Sometimes folks with back pain will have issues where one hip is longer than the other. So 88, or after a hip surgery, a lot of times they'll lose some of their bone mass in the hip. So they'll lose part of the length of the bone, and then when we know problems like that, especially when it goes along with back pain, we can perhaps recommend orthotics in the shoes, maybe send our patient to a podiatrist, and they can get inserts in the shoes to the affected foot, the shorter one, to raise it up a little bit so that way it's in alignment with the other one. And that would a lot of times take care of a lot of pain issues in the feet. So that is our musculoskeletal exam. Any questions for me?
No.
All right. Thank you very much, Mrs. Tuvis.
Thank you.